We're off to Brodick to meet Lynn Ross, who was diagnosed with type 2 diabetes in 2001. Living on an island conjures pictures of healthy living, fresh food and a slow pace of life. How easy is it to maintain a healthy diet?
We're very privileged because we have access to good organic produce and good healthy food, and we have access to the facilities here at the hotel and the gym and the swimming pool. It's like everywhere else, you have to take advantage of it, you have to be conscious of it, and if you are on Arran, then you're very lucky because it's all here for you.
You told me earlier that you've lost 1.5 stone in weight. Do you feel better for this, and how has it affected your diabetes?
It makes me feel much better, and of course it's easier to control the sugar levels when you weigh less. I mean, the more weight that you lose through healthy eating, the better it is for you. So I feel good.
With me is Dr. Campbell from Lamlash Medical Centre. Dr. Campbell, you have seen a twofold increase in the number of patients diagnosed with type 2 diabetes on the island in the past 5 years. Do you feel this represents a worrying trend?
Yes, I think it does. Over the last 5 years we've seen a huge increase, and although it follows national trends, we also think this increase is partly due to better case finding.
You told me earlier that you caught a few patients as having type 2 diabetes. How did you diagnose these patients? Was it as part of some routine testing?
Yeah, realising the benefits of intervening in diabetes early, we're now screening all at-risk people. This has turned up not only new diabetics before they develop symptoms, but we're also able to give them lifestyle advice before they actually develop diabetes in the hope of prolonging the time they have before it arrives.
We've moved along the island to meet Edna Pickin, who lives in Kilmorey. Would you say you're on top of your diabetes?
I think so, with, as I say, the help of Dr. Campbell. Not that I like the tablets that he has me packing into myself every day. Well, he says to keep me living, so.
Our day would not be complete without visiting retired engineer Callum Allison. Your diabetes was aggravated by your heart medication. Were you aware this was going to happen?
No, I wasn't. I don't know whether they keep that from you or not, or whether they consider one major problem at a time, you know. I mean, I was definitely going to die, without any shadow of a doubt. I definitely had only a fortnight to go when I received my heart. So it didn't matter what swings and roundabouts came after that. They were saving my life, and I've saved it now for 7 years, so you can't fall out with that, can you?
The drugs have caused you to put on weight. Do you have to watch your diet, and are you able to do much in the way of exercise?
I do my very best. As I said, Sarah, last winter I did attend Lamlash War Memorial Hospital for a rehab course of 1 hour, so, and I've got the certificate to prove it. All signed and sealed. It was good fun, actually. I enjoyed it. There was lovely girls through there in the physiotherapy. Keep an old man on his toes. And I do these. I've got these exercises that I can do in the house. I could have got a stair lift, but I refused it. I go up and down the stairs in the house as much as I can. I go out and in round the back garden. Even in the winter, I'll walk round the block, back in out the back door and in the front door, just to keep myself moving, you know. And there are exercises you can do sitting in your chair. I mean, you can sit and move your feet like that, you know. There's all sorts of things you can do that exercises you. Breathing's also another vital part of relaxation and being good to yourself bodily. Just to sit and go in through the nose and out through your mouth, you know. And relax when you're doing it.
There's much to learn: daily routines, new pills, blood glucose monitoring and sick day rules. Let's break this down into more easily digestible chunks.
There are a number of drugs available for diabetes, drugs that control your blood sugar and other drugs that are used to reduce the risk of long-term complications associated with diabetes. Metformin is a drug used to lower your blood sugar, and we believe it does this by increasing your sensitivity to insulin. It is also now known that metformin offers a lot of protection against the long-term complications of diabetes, particularly the heart. Gliclazide and other drugs like gliclazide are used to lower the blood sugar. They increase the release of insulin from your pancreas. Gliclazide is often associated with weight gain, which is a concern for many people with type 2 diabetes. There are other drugs used to control blood sugar, called glitazones. The information regarding your treatment options should be available from your doctor or nurse. Diet is the cornerstone of diabetes therapy. However, diet and drug therapy can sometimes fail, and that means that insulin injections need to be considered as a treatment for people with type 2 diabetes. The amount of drug therapies now used for people with type 2 diabetes has increased greatly. It is vital that people with diabetes understand why they are taking these tablets, and only regular compliance will benefit their long-term health. As new information becomes available, it is possible that people with diabetes will be on even more tablets.
All medications have complex effects in the body and should be taken according to medical advice. Some drugs would not work if not taken properly. For example, gliclazide should be taken ideally 20 minutes before meals. Metformin can be taken at any time, but it is often recommended you take it after meals to reduce side effects on your stomach. Many people with diabetes also have high blood pressure, for which they would be taking tablets. It is also very common to be given tablets for blood cholesterol. These tablets protect you from heart attacks and strokes. Sometimes people with diabetes have other illnesses like asthma or arthritis, for which steroids may be prescribed. Steroids can raise blood sugars, and you may need to increase diabetes medications or insulin doses. At such times, blood sugar should be checked regularly, and you should contact your nurse or doctor for advice. High blood sugars should not be ignored. Some drugs can interact with other tablets or what you eat. Some cholesterol tablets, called statins, can interact with antibiotics or warfarin tablets, increasing the side effects of one or the other. Also, the statins can cause more side effects if someone drinks grapefruit juice regularly. This is because grapefruit juice hampers the clearance of the drug by the liver. Remember, tablets are chemicals that can interact with other substances. Therefore, always check with your doctor or pharmacist and do not self-medicate, especially if you are on multiple tablets. Similarly, painkillers are commonly used by many people for arthritis or back pain. Some painkillers, like diclofenac, can cause damage to your kidneys, especially if taken long-term. Since people with diabetes are at increased risk of developing kidney problems anyway, they should not take painkillers without medical advice. Research suggests that many people with diabetes use complementary therapies like herbal remedies or dietary regimes. Usually, compared to conventional medicines like metformin, there is very little research evidence that would support the use of complementary therapies, and it is important to discuss potential problems with your therapist, telling them that you have diabetes. Sometimes such therapies can actually be dangerous. For example, diabetes can cause loss of sensation in the feet. Acupuncture in such patients can be extremely risky and lead to infections and damage to the feet. From the above discussion, you will see why your doctor in the diabetes clinic would want a full review of all medications that you are taking at one particular time. It is useful to show the doctor a list of all your medications at the time of diabetes review. There is a huge amount of evidence that supports the use of conventional medicines like metformin and insulin in diabetes. Most of the complications of diabetes can be avoided if blood sugars are well controlled from the time of diagnosis. If you have any concerns regarding your treatment, always talk to your doctor or nurse about it.
When a patient is newly diagnosed, what form of monitoring would be taught?
At diagnosis, many people are a bit shell-shocked and don't always process much of the information from their healthcare professional. So it wouldn't always be appropriate to teach self-monitoring at that particular time, depending on the circumstances. Many patients will be on diet control only for the first few months and will be monitored by their nurse or GP. After that, if the person wishes to monitor their diabetes, there are two options: to monitor the urine with a dipstick test or to perform blood glucose tests with a blood glucose monitoring machine.
Home urine glucose tests are available in strip form. Urine specimens must either be collected in a clean, dry container, one would then dip the test pad into the collected specimen, or the test may be done by passing the test pad through the urine stream to saturate it. Results are obtained by noting the presence of a visible colour change on the test pad of the strip. During blood glucose monitoring, the finger is pricked and a drop of blood is put on a reagent strip. The strip uses a chemical substance to react to the amount of glucose in the blood. The meter then reads the strip and displays the results as a number on a digital display. Newer monitors can use blood from other areas of the body besides the fingers, thereby reducing discomfort.
Hypoglycemia, or hypo as it's more commonly known, is a medical term for low blood glucose, which can occur when you have diabetes. Hypoglycemia is defined as being when the blood glucose measurement falls below 4 millimoles per litre. This does not usually happen in those with type 2 diabetes controlled only by diet, but can happen if you are taking insulin or sulfonylurea tablets such as gliclazide or glimepiride.
There are two categories of hypo. There are those with symptoms that you can recognise and treat yourself, and there are the ones that have to be treated by a family member, a friend or work colleague. In other words, someone who has knowledge of your diabetes and will be able to treat your hypo for you. Remember that the beginning of a hypo will probably feel different to the last one you had. Of course, each hypo feels different to each individual, but there are some symptoms that you may recognise. You feel weak, wobbly, even shaky. You could feel sweaty, have a tingling sensation in your mouth, or suddenly feel very hungry. You may also become confused, have a headache, a fast or pounding heartbeat, and experience blurred vision. Any one or combination of any of these symptoms should be regarded as an indication that something is wrong and action needs to be taken. If your blood sugars should drop any lower, other people around you may notice that you appear to be pale, that you are slurring your words or acting out of character. You could become unusually aggressive or seem to lack concentration. If these symptoms are missed, you may lapse into unconsciousness, and that requires immediate and urgent medical attention.
Hypos can occur if you have taken too many tablets, if you have taken too much insulin, if you have not eaten enough food, especially carbohydrate, or if it has been too long since you last ate. Hypos can also happen if you have taken more exercise than usual, which can include shopping or gardening, if you had taken a lot of alcohol and not eaten enough, or if you are ill or under stress and in hot weather. To treat a hypo, you need to take some replacement quick-acting glucose right away, such as a small glass of fruit juice or Lucozade, a glass of non-diet drink such as Coke or lemonade,
or 3 or more glucose tablets. This should always be followed up with longer acting carbohydrate such as a sandwich, a bowl of cereal, fruit or biscuits and milk, or take your lunch or dinner if it's that time. If you check your blood sugar with a blood glucose monitor, you should recheck it 5 to 10 minutes after you have treated your hypo to make sure you are responding. If not, take more juice or glucose tablets until the blood sugar comes above 4 millimoles per litre. If you're not blood glucose monitoring and you're feeling hypo due to exercise, for example, follow the same treatment until you feel better. If you're a friend or a carer treating someone with a hypo and they have become unconscious, do not give anything by mouth, but call for help.
So, let's summarise this information. As a type 2 patient, you may be taking insulin or sulfonylureas like glipizide or glibenclamide or something similar. Whatever your medication, it could be helpful if you inform all the people with whom you work or socialise of your condition and of the possibility of you having a hypo. Explain what that is and how it should be treated. Point out to your friends and colleagues where you keep your glucose tablets, and also that any source of sugar, such as a non-diet fizzy drink, will be a help in the first instance. For a type 2 diabetic, it is also important to remember that a hypo depletes the amount of glycogen in your liver for up to 24 hours. That means that a second hypo within that period could be far more severe. Should you start to have frequent hypos, or if you are having them just now, speak to your GP or your diabetes nurse specialist as soon as possible. Do you do your own blood glucose monitoring?
I do it every morning, and 2 days a week I do it 6 times a day. And if I'm in any doubt, I do an extra.
Yeah, I usually do it every couple of days. Usually I try and do it maybe before breakfast, before tea time are the 2 main times that I check. My readings are between about 4 and 5 now. They really stay quite good, quite level.
One of the most common mistakes made by people with diabetes who are ill is to stop taking their diabetic medicine. Even when you eat less because of not feeling well, you need to take your diabetic medication. Illness is a stress on your body that can cause blood sugar levels to rise. General sick day rules are:
continue taking your normal diabetes medication. Increase your fluid intake to avoid dehydration, about 100 to 200 ml of sugar-free liquids hourly. Get plenty of rest, as exercising during illness can raise blood sugar levels even higher. Eat normally if you are able. If not, substitute normal foods with carbohydrate-containing drinks or easy-to-manage snacks, such as milk, fruit juice, ice cream, yogurt or soup. If you're taking insulin, you may need to adjust your doses during an illness, and it is important to check your blood sugar levels more frequently so that you know what is happening. Most commonly, blood sugar levels rise during illness and you need to increase your dose of insulin. But on rare occasions, blood sugar levels may go low, as in hypoglycemia, and medication may need to be reduced. Contact your diabetes team or GP if you are in any way unsure about what to do, and especially if you are being violently sick. Prolonged episodes of sickness may require hospital admission to correct dehydration, so it's important not to wait too long before asking for help, especially if you are alone at home. It's best to be prepared. Discuss what adjustment of medication you may need to make during illness with your own diabetes care provider before it happens.
Everyone with diabetes is potentially at risk of developing long-term complications of the condition. The purpose of your clinic visits, tests and various treatments is to monitor how well your diabetes is controlled, to reduce the chance of developing complications, and to screen you to spot developing complications at an early stage when treatments are more effective. Marianne went to see a clinic in a primary care centre in Glasgow. Marianne?
During your visit to the clinic, be it with your GP or local hospital, you will have various tests. These are to help pick up early signs of complications.
Every GP practice or hospital holding a diabetes clinic may be different from the one we are about to highlight. Tests and how they are carried out will also differ. Your blood pressure should ideally be 140/80 millimeters of mercury. You may be prescribed a blood pressure tablet. This will protect your heart and circulation. You will be asked to provide a urine sample for the clinic visit. This is to test for glucose and protein. Glucose in the urine tells us that your control may not be as tight as we would like it to be, while protein can be an early indication of kidney damage. It is important to detect any small leakages of protein, as this can be treated to try and prevent the damage from getting worse. A nurse will usually take a blood sample that is drawn from a vein in your arm. The sample is tested, and the results tell us many things about various organs, and also gives us a baseline for future blood tests. Your HbA1c will be checked. This looks at your overall glucose levels over the last 90 to 120 days. Think of your HbA1c like a series of photographs. It's a series of snapshots taken over a period of time. A non-diabetic would expect a figure between 5 and 6.5%. Diabetics can expect to be higher than this figure. However, your local care team will give you a figure to aim for, taking into account your age, weight, and personal circumstances. Remember, any improvement to your HbA1c significantly reduces the risk of long-term complications. Have you heard of HbA1c, and has it been explained what it is?
Well, you can't cheat in that one. Most people, when they're going to the clinic 2 days before it, they either starve themselves or live in balloons. But that one is over a period of 2 to 3 months that you don't know when. It's something to do with the things that stick to blood vessels, and you can't alter that. It's how you've behaved over a much longer period. So it's quite good to keep you in check.
Your cholesterol or blood fat level will be checked. The figure for this changes yearly, but your doctor will decide if you need to be put on a cholesterol-lowering drug called a statin. The effects of this will reduce your risk of cardiovascular disease by 1/4. Eye screening is very important. We can detect small changes in the back of your eye and treat this if necessary. We are looking for signs of retinopathy, which is damage to the retina. That is the light-sensitive part in the back of the eye. Nationally, there is a new development in eye screening which aims to take a digital photograph of the retina of all those with diabetes on an annual basis. This may occur at your local diabetes clinic or in the community, depending on where you live.
Okay, Billy, so it's just to check your feet to make sure there aren't any diabetic complications in your feet. So I'm just going to check your pulses. Have you had any funny sensations in your feet in the last year or so?
None at all.
Foot care is also very important. You should tell your doctor or nurse if you have any problems with your feet, because small cuts or sores could turn into major problems.
So now I'm going to check for the feeling in your feet.
Okay.
And I think you've had this before, haven't you? You know what to do. If you just close your eyes, please, and say yes each time I touch you.
Yes. Yes. Yes.
If nerve damage is found, you will be further assessed by a podiatrist, who is a specialist in foot care.
Okay.
What's the danger signs that I would have to look for in my feet if...
You would check your feet every day, and what you'd be looking for is anything that looks different or anything that looks nasty, any signs of redness. You wouldn't worry too much if you had a small graze or cut in your foot, unless if you were looking at that every day, things were not healing properly, getting worse instead of better.
Around the time of your first visit, you will see a dietitian. This is a specialist in the correct dietary requirements needed to keep you healthy.
The one thing I'd like to ask you is, I feel I'm eating a wee bit too much in the evening. I was quite disciplined before, just, you know, sticking to like a wee snack before I went to bed, but now I feel for some reason I'm eating a lot, like low-fat crisps, lots of wee snacks, digestive biscuit, a scone, whatever, and I seem to have got into this terrible habit where I feel I'm eating continually through the evening. And I'd like to be able to stop that if I possibly could, because I realise it's not good for me, and I know that's why my weight loss has slowed up a wee bit.
Understandably, yeah, because obviously eating before you go to bed is the worst time to eat, because you're just going to your bed and you're not burning up any, well, you're not doing any physical activity to burn up any calories. So the first piece of advice I would give is to try and fill up on your evening meal.
Okay.
Like have your starchy carbohydrate and your vegetables or salads should make up the biggest portion on your plate, with the meat being the smallest portion. So trying to fill up on your starchy foods and your vegetables would be the first line that I would give to you. If you're looking for a snack before bed, I'd probably say something like fruit would be the best thing. Even though fruit's got the natural sugar in it, it's also got fibre in it as well, which helps to slow down the absorption a wee bit more. So something maybe like an apple or an orange or any type of fruit that you like, but obviously if you're having the smaller fruits, like grapes or strawberries.
This consultation is also a good time to ask about any weight concerns you may have, as dietitians will give you free and useful advice about various food options. The doctor will see you with the information that has been gathered about your diabetes and will discuss any actions or changes of treatment that are required. Doctor will also decide then and with you when you should next be seen.
I'm just going to ask Dr. Lynch, I'm actually taking these wee Flora Proactive drinks at the moment to help reduce my cholesterol. Is it still safe to take that while I'm taking this statin tablet?
Sure, absolutely no problem. They wouldn't have any interactions with one another. Good. So no, you'd be safe if you're happy to continue along with that.
Yeah,
that'd be
maybe
fine.
just any wee extra help.
Yeah, absolutely.
Yeah, that's good, thank you. That's lovely.
It is important to realise that different primary care centres in Scotland offer various services to the one highlighted here, but all of them should offer you the same level of care.
Primary care is taking over the role of treating newly diagnosed type 2 patients. Have you found it a challenge?
Yes, it certainly has been in terms of workload demand, but the diabetic mini clinics that are now part and parcel of general practice are having positive benefits on diabetic care and quality of life for our diabetics. Certainly the feedback from our diabetics is positive.
At what point would you refer patients to hospital?
Happily, the requirement to refer patients to hospital has much declined over the years as a consequence of the input from the mini diabetic clinic and the input from the diabetic liaison nurse. We are seeing less complications because of the effectiveness of the diabetic in-house clinic. If we require further advice or consultant input, our consultant colleagues are available at the end of a phone at our local general hospital. And as far as toe sensation,
they're fine.
etc., and circulation, she was quite happy with that. That's good.
Now back to Edinburgh to speak to Dr. John McKnight, who's going to tell us about some serious complications that you should be aware of.
Dr. McKnight, can you talk us through the 5 main complications, and is it possible to avoid them?
First main complication that is quite serious in people with diabetes is that they're more prone to develop heart attacks or strokes, or indeed develop angina. There is a very good amount of evidence now to show that some of this is preventable by treating blood pressure well and by lowering the cholesterol in the blood. And some people would also benefit from aspirin treatment. And all of these treatments have been shown to prevent heart attacks and strokes in people with diabetes. Secondly, diabetes can damage the blood vessels in the back of the eye at the retina. This is called diabetic retinopathy. And for some reason, people with diabetes get very specific changes in the back of the eye, this can, if it's left untreated, result in damage to the eyesight. So we're able to screen for this by nowadays taking a picture of the blood vessels in the back of the eye to look for early changes. And if there are early changes, then we actually treat the blood sugar and the blood pressure a bit more aggressively than in people maybe who don't have changes. But also, if these changes are getting worse, then laser treatment specifically to the back of the eye can actually save vision and prevent visual loss. Diabetes can also damage the nerves and blood vessels to the feet, and this can sometimes result in ulcers developing in the feet, and if these become worse, an amputation is sometimes required. It's important, therefore, when you have diabetes to have your feet examined at least once a year to make sure that early changes in the circulation or nerve supply is picked up, and that if that's the case, the feet are regularly checked to pick up early damage and then treated appropriately. It's been shown clearly that if this is treated appropriately, then the chance of amputation is much less. People with diabetes can also develop kidney damage, particularly due to diabetes. This is first picked up by checking for microalbuminuria, which is a very small protein leak from the kidneys. If people have this microalbuminuria, it can be treated by particular drugs to reduce the blood pressure, and also it is sometimes a marker of a higher risk of heart attacks, strangely enough, and therefore treating the blood pressure and the cholesterol, as I've mentioned before, is very important in people with these kidney changes. Rarely the kidney damage can progress and people can need treatment for renal failure with dialysis. But with early good treatment, much of this can be delayed greatly or indeed prevented. Type 2 diabetes occurs mainly in older people, but nowadays there are some younger people developing type 2 diabetes. And if a woman develops type 2 diabetes and still may be able to have children, it's very important that the diabetes is extremely well looked after before pregnancy is considered. This is important because if the diabetes is not well controlled, there's a far greater risk